Welcome back, all of you, to Mock Test Explanation Series, Part 29 for Government Nursing Officer Exams. The first question: a patient is scheduled for a total pancreatectomy. The nurse understands that this procedure most likely will cause option A, pancreatic ascites, option B, chronic pancreatitis, option C, diabetes mellitus, and option D is diabetes insipidus. The right answer is option C, diabetes mellitus. Pancreas is producing insulin, which is responsible for controlling the blood sugar, and the absence of this insulin can cause diabetes mellitus. A total pancreatectomy would most likely to lead to lifelong exocrine and endocrine insufficiency, resulting in a need for insulin and pancreatic enzyme replacement therapy. Next question: in which of the below episiotomy tear Hannon's inter is intact? Option A, first degree, option B, second degree, option C, third degree, and option D is fourth degree. The answer is option D, second degree. Episiotomy tear and degrees. First degree, a superficial tear limited to skin and vaginal mucosa. Second degree tear is a deeper tear that extends into the perineal muscles but not the anal sphincter. Third degree involves the anal sphincter muscle. This can be further classified into subcategories depending on the extent of the anal sphincter tear. And the fourth degree is the most severe tear involving the anal sphincter and extending into the rectum, the lining of the anus. The tips to remember is: first degree involved vaginal mucosa, second degree involved perineal muscles, third degree involves anal sphincter muscles, and fourth degree will involve anal sphincter and extend to rectum. This is the diagram to see the anatomy. Next question: an ileostomy would expected to be located in which quadrant of abdomen? Option A, right lower, option D, left lower, option C, left upper, option D, right upper. The right answer here is option A, right lower. An ileostomy is typically expected to be located in the right lower quadrant of the abdomen. This placement is chosen to facilitate easy access and visibility for the patient, while also minimizing potential issues with belt, clothing, or skin folds. The diagram, we can see this is the right lower quadrant where the ileostomy is typically expected to be located. Next question: exclusive breastfeeding is up to option A, 1 year, option B, 2 years, option C, 6 months, and option D, 4 months. The right answer here is option C, 6 months. Exclusive breastfeeding is recommended for the first 6 months for an infant's life. This means the baby should receive only breastfeeding. Exclusive means only breast milk with no other foods or drinks, including water. After 6 months, complementary foods should be introduced alongside continuing breastfeeding. So, another question can be asked is, at what time the complementary food should be introduced? That is also 6 months. Next question: a patient with poor wound healing and poor appetite has an order to begin TPA. The nurse should prepare option A, pair of sterile glove, option B, syringe pump, option C, infusion pump, and option D is betadine solution. The right answer is option C, infusion pump. This is the application level question which is requiring nursing application. Here, poor wound healing and order to start TPN, total parenteral nutrition. This is a big bottle or big baxter. So, normally the infusion pump is required. Syringe pump is for ionotropes or small syringe which is in 50 ml syringes or 20 ml syringes. Here, it is a large quantity like 1 liter or 500 ml. So, this large quantity of volume should be administered through the infusion pump. Pair of sterile glove, betadine solution, etc. is for the sterile procedure like catheterization, wound dressing, etc. Next question. Which is not included in triage system? Option A red, option B yellow, option C green, and option D blue. The right answer is option D blue. Normally, the 3-level triage system will indicate or will include 3 colors: red, immediate, yellow, delayed, and green, minor. So this is the common triage system. So in that, the blue triage color is not included. Black will be for the depth or diseased patient. So normally red, yellow, and green is involved. That's why the blue can be taken out among from these options. But sometimes in 5-level triaging, sometimes in some areas, blue is also considered. But here it is not applicable. So blue is the wrong option and it can be selected as the explosion. Next question. A patient is having difficulty cognitive abilities after stroke. What part of the brain was most likely affected? Option A midbrain, option D cerebrum, option C medulla oblongata, and option D is cerebellum. Let us go to the right option. Right option is option B cerebrum. After stroke causing cognitive difficulties, the frontal and temporal lobe of the cerebrum are most likely affected. So damage to these areas can lead to various cognitive deficits including memory problem, difficulty with planning and problem solving, and language impairments. You can see the diagram. So cerebrum is the part affected in cognitive impairment. Next question. India started COVID-19 vaccination with Covaxin on option A October 2021, option B 18 December 2021, option C 16 January 2021, and option D 22 November 2021. The right answer here is option C 16 January 2021. India began administration of COVID-19 vaccines on 16th January 2021. Next question. While the nurse is administering a large volume enema, the patient complains of cramping. The nurse should option A increase the flow rate, option B elevate the head of the bed, option C gently massage the abdomen, and option D lower the fluid container. Let us go to the right option. The right answer here is option D lower the fluid container. Lower the fluid container will help to alleviate the cramps while administering large volume enema. Next question. Convert 38.6 degrees Celsius to Fahrenheit. Option A 98.6, option B 102.2, option C 101.48, and option D is 103.82. Let us see the right answer. Here a correction. Please read this as D. This is a typing error. Right answer is option C 101.48. The formula for converting is Fahrenheit is equal to degree Celsius into 9 by 5 plus 32. So here the calculation, temperature is 38.6 degrees Celsius. To convert to Fahrenheit, 38.6 degree Celsius into 9 by 5 plus 32, that is 101.48 degree Fahrenheit is the right answer. Next question. A patient had a total abdominal hysterectomy 2 days ago and has not been out of bed yet. The patient is complaining of left leg pain and swelling. The nurse action next is option A gently massage the patient's leg, option B assess the patient's pain level, option C assess the patient for command sign, and option D instruct the patient to reflex the left knee and hip. The right answer here is option C assess the patients for command sign. After total abdominal hysterectomy, there is an increased risk of deep vein thrombosis or DVT, which can cause leg pain, swelling, and tenderness. The Homan sign is the test that helps to assess for DVT. It involves flexing the patient's foot while gently pulling the leg back towards the knee. If this causes pain, it would be a positive Homan sign indicating a potential DVT. This is the diagram to assess for DVT by checking Homan sign. Next question. In laparoscopy, gas used is option A CO2, option B N2O, option C O2, and option D helium. The right answer is option A CO2. Carbon dioxide or CO2 is the gas mostly used to inflate the abdominal wall during laparoscopic surgery. This process is called pneumoperitoneum. This is the diagram. Inflated the abdominal cavity using CO2. Next question. Which of the below gauge needle the nurse will refer to use for an intradermal injection on the ventral surface of forearm? Option A 18 gauge, option B 20 gauge, option C 22 gauge, and option D 26 gauge. The right answer is option D 26 gauge. The higher the number of gauge, it will indicate the fine needle. For intradermal injections, a fine needle is needed to ensure the medication is delivered into the dermis, the layer of skin just below the epidermis. So 26 gauge is the higher here. It is typically used for the ID injection. Next question. Fluid of choice in bone pressure. Option A 0.45 saline, that is half saline. Option B 0.25 saline, quarter saline. And option C 3% saline. And option D ringer lactate. The right answer is option D ringer lactate. For burns patient, lactated ringer or ringer lactate is the preferred solution or fluid for initial fluid resuscitation. It's a crystalloid solution that effectively addresses hypovolemia and electrolyte imbalance caused by the burns. The Parkland formula is widely used as a guideline to treat with RL for fluid replacement. Here, the Parkland formula is 4 ml by per kg, 4 ml per kg into the kg into total body surface area. So, if percentage of burning bone is 100, kg is 60, so 4 into 60 into 100, like that we can calculate. So, the half the volume will be given first 8 hours and the remaining will be given in the next 16 hours. Next question. A 7-year-old child is with sudden onset of bright redness on both the cheeks. The child is with fever, 100.4 degree Fahrenheit and chills. The nurse suspects that the most likely diagnosis would be option A fifth disease, option B rotavirus species, option C Roseola infectium, and option D chickenpox. Let us see the right answer. The right answer is option A fifth disease. Fifth disease or erythema infectiosum, also known as slapped cheek syndrome. The symptom described is bright red rash on both cheeks, fever and chills are very characteristics of this fifth disease. So here you can see in the diagram, it is looking like slapped cheek. So both sides of the cheeks are reddish in color and fever plus chills are the characteristics of fifth disease. Next question. Which one of the below given is cause of neural tube defect? Option A iron deficiency, option B vitamin D deficiency, option C previous history of neural tube defect, and option D is folate deficiency. The right answer here is option D folate deficiency. One of the main causes of neural tube defects (NTD) is folate deficiency, specifically not getting enough folic acid or vitamin B9 during early pregnancy. You can see the figure or diagram here for neural tube defects. That's why the pregnant ladies will be supplemented with folic acid along with iron to prevent these neural tube defects. Next question. In planning for care of a patient with Crohn's disease, the nurse expects which of the following treatment modalities would most likely to be considered a primary intervention for this disease? For Crohn's disease, which is the primary treatment modality? Option A, surgery. Option B, medication. Option C, high residual diet. And option D, blood replacement. Let us see the right answer. The right answer here is option B, medication. Crohn's disease. Medication is the initial treatment option. Usually start by managing Crohn's disease with medications like anti-inflammatory drugs, corticosteroids, and immunomodulators to reduce the inflammation and control symptoms. So initially, medicine or medical management is the option. Then diet modification as a supportive option, while dietary changes can help in managing Crohn's disease. They are not considered the primary intervention. This is just a supportive intervention. Then surgery is the severe case for treatment as a last option. Surgery is usually considered as a last resort when other treatment fails or when complications like obstructions or fistulas develops. So first medical treatment as a support, diet modifications, and surgery is the last option for Crohn's disease. Next question. Size numbering of French catheter denotes. For the Foley's catheter, the French, it denotes radius of the catheter. Option B, internal diameter of the catheter. Option C, external diameter of the catheter. And option D, circumference of the catheter. Let us see the right answer. The right answer here is external diameter of the catheter. The size number of a French catheter indicates the outer diameter of the catheter in millimeters, with one French being equal to 1/3 millimeters or 0.30 millimeters. This is the color code for different French size. Next question. A patient with tuberculosis can transmit the disease to another individual through option A, physical contact. Option B, blood and body fluids. Option C, air droplets. And option D, hand-to-mouth exchange. Right answer is option C, air droplets. A tuberculosis patient can transmit the disease through the air by releasing tiny droplets containing the bacteria when coughing, sneezing, speaking, or singing. So tuberculosis is transmitted to droplets. Next question. Which fluid causes shifting of fluid from cell to plasma? Option A, hypotonic solution. Option B, isotonic solution. Option C, alkaline solution. And option D, hypertonic solution. The right answer here is option D, hypertonic solution. A hypertonic solution has a higher concentration of solutes compared to the cell cytoplasm, which leads the water moving out of the cell into the plasma to try and equalize the concentration. Here, in opposite way, hypotonic solution has a lower solute concentration than the cell, so causing the water to flow into the cell, not out of it. Then isotonic is having the same solute concentration, so there is no net movement of water, will not out of the cell. So here tip is hyper out, hypo in to the cell. Remember this word, hyper out, hypo in to the cell. This is the tips to remember for the different kind of solutions like hypertonic, hypotonic solutions for exchange between cells and outer surface. Next question. What would be the long-term goal for a child with asthma? Option A, quickly reverse airflow obstruction. Option B, correct hypoxemia. Option C, deliver humidified O2 via nasal cannula. And option D is develop a home and school management plan. The right answer is option D, develop a home and school management plan. Here, the strategy is the keyword. You can see long-term goal for a child with asthma. When an asthma attacks happen, quickly reverse airflow obstruction is a short-term goal. You have to do it in no time because it's airway priority. Then correct hypoxemia is also an important step. Otherwise, the patient will go to hypoxemia and it will have brain impact and all the complications. Then deliver humidified O2 via nasal cannula is also a short-term goal. Here, develop a home and school management plan is the long-term goal for a child with asthma. So we have to be careful while reading this kind of question because all the options are correct, but the long-term goal is the option D. Next question, height of a neonate doubles by option A 6 year, option B 4 year, option C 2 year, and option D 1 year. Let us see the right answer. The right answer is option B 4 year. Here, the thing you have to remember is the height. A neonate's height typically doubles by around 4 years of age. Height doubles by 4 years. But here weight is the normal question. Normally the weight doubles and weight triples, weight quadruples are asked in the question. So be careful about height and weight. Height doubles by 4 years of age. But weight doubles at 4 to 6 months, triples at 12 months or 1 year, and quadruples at 24 to 30 months or 2 to 2.5 years. So be careful about height and weight. Next question, the phobia in which there is irrational fear of being disconnected from mobile phone. Option A, monophobia. Option B, oculophobia. Option C, gamophobia. And option D, nomophobia. The right answer here is option D, nomophobia. Nomophobia is no mobile phobia. Nomophobia is the fear of being out of contact with a mobile phone. So other phobia, see these words are similar, nomo and mono. So be careful about this kind of similar words to identify it correctly and lock without error. Monophobia is fear of being alone or isolated. Oculophobia is fear of crowd, and gamophobia is fear of marriage. Gami is marriage, so gamophobia is fear of marriage. How to remember with this kind of tips. Next question, SSP is complication of which disease? Option A, whooping cough. Option B, measles. Option C, meningitis. And option D, tetanus. Let us see the right answer. The right answer here is option B, measles. Subacute sclerosing panencephalitis, that is SSP, is a rare but serious complication of measles or rubella, a viral infection. Next question. This is the last question of this session. Thought process characterized by a series of ideas without apparent logical connections is referred to as option A, loosening association. Option B, flight of ideas. Option C, clang association. Option D, tangentiality. The right answer is option A, loosening of association. Loosening of association, also known as derailment, refers to a thought disorder characterized by lack of logical connection between ideas in speech. Flight of ideas is rapid shift in thoughts. Clang association is a type of word association where a person connects words based on their similar sound rather than the meaning or logical connection. So, clang association, they are relating the words with only similar sounds, not with the meaning. Flight of ideas, rapid shift of thought. Tangentiality, the speaker deviates from the main subject without returning to the initial point. So, they are just beating around the bush. This is tangentiality. So, be careful about all these terms. These are similar, but there are differences as well. Be careful and pay attention to select this kind of question without any mistakes. So we are winding up this session. Thank you all for watching this video. Please like and share for more videos in this series. Thank you so much.